and welcome to the instructional tutorial for a skilled nursing visit. You would have your username entered, your password, and should you have problems with your password, of course you can communicate to the office to help us reset it for you. You would go to your designation as an RN and or an LPN if you are assisting a nurse in the field who could not make the visit. We select our patient, of course. We do our COVID screening before we enter the home. And we go to our skilled nurse visit note. As always, we want to confirm that our event code is proper. We must put in our skilled nursing because the service and the event code assimilate for all paying, payer, and billing options. We put in our time. The patient signs at the end of the visit. We check to make sure that they don't have any medication changes. If they do have medication changes, we will follow through with our physician's order and review the video for how to create an interim order. There could be observations. Maybe the patient went to the doctor. They were worried about the site. We take our vitals. If the patient's vitals or any part of them seem high, we can always check the vital signs clock to see what was documented. Maybe it's normal for the patient. Maybe the patient is spiking or some kind of an infection is occurring or multiple other scenarios. Did we verify the information with the patient? And of course, click standard precautions. As when we came in, we did our proper bag technique with our barrier, we cleaned our hands, and we have our setup ready. We assess the patient for pain. We watch closely to obviously check any of these scenarios if they apply. If this visit is for wound care, obviously we would allocate the appropriate numbers to wherever we are doing this care. We're reviewing the color. We're listing all of our necessary fields here. If it was a right knee, did they have staples? Is this our first visit and we're reviewing the incision for the first time? Was it a new wound? And we're gathering data for care, which may potentially then require a physician's order, which we may have to get in the home, because we need to treat this patient immediately. And of course, if we need a picture, we want to make sure that the patient had signed that consent and agreed to the picture taking. We fill everything appropriately. If we cleaned it or packed it, any dressing, drainage noted, the appearance of the wound site, and then we go to the next page. The next page gives us our body systems. Wherein we're doing our patient assessment, or you may have started with your patient assessment and you can document same towards the end of your visit. Note anything necessary in the comments section under each specific body system that could apply to the patient, or something that maybe the nurse is required to look at. Maybe this is the LPN covering for an RN and the RN is something going to need to look and review at something specific in the case the next time she visits the patient. The GU, GI, patient's neuro, musculoskeletal condition. If there are no labs, we should of course always hit not applicable. If there was an infusion, we would have used an infusion note. And now all of our fields here can definitely be brought in. The luxury of our system pulls in from our previous plan of care that was created. We should review our interventions to know what we're covering in the home for the patient. Do they apply? We should not just read them. We should know what we're putting in our note. Obviously, if you created it, you would know what's there. If there was any pertinent education that was needed per your interventions with the patient, if we had to review the diet again, maybe the patient's blood glucose was off and they were having problems, maybe if there was an infection obviously that's brewing, it can affect various scenarios, and what the patient's response to this education was. Of course, we want to put our correlating goals to any interventions we document. If we don't put all of them down, do they correlate? Something that we need to be wary of when we're doing our notes. And with experience will come quicker results, thereby allowing you to finish the note within the home and send to office. Was there any supervision done this visit? No. Of course, we don't want to leave any fields blank. If we did have to contact the doctor for any orders, if there were new wounds, if the wound wasn't looking good, if we had to send the picture to the doctor, our care coordination would be with the physician and, of course, our office supervisor. We would add our discharge planning and any plans for our next visit. If you're comfortable and feel that every section of your note is done, you can send to office. If you would like to review it, we can save it. And we can review it in our pending file later on. You are now done with your skilled visit note. Of course, if you had to review the medication profile with the patient, you would have gone into the patient's medication profile, which we should be doing every visit just to review them with the patient. Have there been any medication changes? The patient could say that the oxycodone was DC'd because he's tolerating the Tylenol well. And we would hit the DC date and do an interim order for that change. Sorry. We are done with this. And here is our pending. This is my skilled visit note that I did just now. Maybe I want to just review it in the car. I want to open it back up and make sure I'm comfortable with it and send to office. Just as a reminder, the office has a 48 to 72 hour policy on the receipt of any and all notes. Thank you very much again. This was the review of a skilled nursing visit. Should you have any questions, please give us a call. And again, thank you very much.